we are proud to present the Philippine Pharmacy Roadmap 2030, Sustainable Advancement for Education and Workforce. The Commission on Higher Education Technical Panel for Pharmacy Education has appointed the University of the Philippines College of Pharmacy core team, led by Dr. Margarita M. Gutierrez, to serve as the technical working group. This team collaborates with a diverse array of stakeholders from both the Philippines and abroad. Principles of strategic planning, transparency, evidence-based practices, and participatory engagement guide the development of this roadmap. This initiative aligns with Sustainable Development Goal 4, which aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all by 2030. The Commission on Higher Education's mandate also focuses on accelerating and developing professional competencies. This empowers individuals to drive transformative change in health and well-being, industry, innovation, infrastructure, gender equality, decent work, and economic growth. The website for the roadmap is https://philpharmaroadmap2030.my.canva.site. It is accessible on both desktop and mobile devices, allowing users to access the full roadmap and other supplementary materials directly from the site. Following these public consultations, a vision for Philippine pharmacy education emerged: to produce and cultivate globally competent Filipino pharmacists as medication and health product experts responsive to the evolving needs of healthcare systems from drug discovery to public health. To achieve this vision, by 2030, our mission is to establish a dynamic framework that strengthens the Philippine pharmacy landscape through Pharma-P, promote a ladderized and outcome-based pharmacy education framework aligned with international standards. H. Hone the clinical competencies of pharmacists for public safety and better health outcomes. A. Advance translational research from pharmaceutical sciences to pharmacy practice. R. Reinforce the contributions of pharmacists to universal health care by enhancing their role in public health. M. Manage our resources and strengthen collaborations, all while advancing sustainability in pharmacy through the integration of appropriate technology. A. Advocate the highest ethical standards and professionalism in pharmacy education, research, and practice. The collective insights formed have identified core competencies that aim to equip future pharmacists with the knowledge, skills, and values necessary to excel in their profession and contribute meaningfully to the healthcare system. By fostering a shared vision among pharmacy schools nationwide, these competencies will help create a more cohesive and effective pharmacy profession, better serving the needs of the Filipino people. For the core knowledge represented by the head, pharmacotherapy and patient care, medication and health product development and manufacturing, public health and healthcare systems, regulatory, legal, and ethical aspects of pharmacy, digital health, technology and innovation in pharmacy, healthcare response and emergency preparedness, for the core skills represented by the hand, clinical, dispensing, and pharmaceutical care skills, technological skills, communication and interpersonal skills, GEXP and documentation skills, leadership, management, and entrepreneurial skills, research, analytical, and problem-solving skills. For the core value represented by the heart, professionalism and ethical integrity, cultural competence and inclusivity, commitment to excellence and continuous self-improvement, public service and social responsibility, empathy and altruism, creativity and innovativeness. Filipino pharmacists face significant challenges in defining their professional identity despite the symbolic white coat ceremonies. To tackle this, the Pharmacy Education Roadmap team suggests a unified, distinct identifier for all registered pharmacists. This emblem, to be worn on the left upper arm, would symbolize their professional dedication and enhance recognition by patients and colleagues alike. Pharmaceutical organizations and schools have the option to personalize the design with their names, achieving a balance between uniformity and institutional pride. This initiative ensures that pharmacists are easily identifiable across various settings, reinforcing their distinct identity and unity within the healthcare workforce. Additionally, the patch can be adapted for scrubs or other uniform designs that are more suitable for the tropical climate in the Philippines. This approach promotes both cohesion and customization, harmonizing professional unity with individual expression. The current pharmacy education framework aims to elevate the quality and relevance of pharmacy education in the Philippines by aligning it with the Philippine Qualifications Framework. However, notable areas for improvement remain: limited exit points, as students still need to undergo technical education and skills development authority training or assessment for certification despite completing year levels; limited progression opportunities beyond the master's degree and PhD, both of which are academic tracks; uniform classification at Philippine Qualifications Framework Level 6 for all graduates regardless of program length, failing to recognize diverse educational pathways and practical experiences; and the current 4-year program's misalignment with global standards, preventing foreign board eligibility immediately after graduation. Addressing these issues requires a more flexible and inclusive system. By reforming the pharmacy education framework, we can ensure that the education provided is of high quality, relevant, and adequately prepares graduates for the diverse challenges and opportunities in the field of pharmacy. The proposed pharmacy education framework in the Philippines aims to enhance the quality and relevance of pharmacy education by aligning it with the Philippine Qualifications Framework. It integrates technical education and skills development authority certifications throughout the curriculum, ensuring graduates possess both academic knowledge and practical skills valued by employers. The framework also prepares students for foreign board examinations by offering optional additional coursework and clerkship, and provides clear professional progression tracks, including advanced studies and specialized training. The key features of this framework will be discussed in detail in the next parts. The ladderized pharmacy education framework is designed with multiple exit points, offering flexibility for students who may face challenges in completing the entire program at once. This outcome-based framework enables students to gain employment at various stages of their education. For instance, after 2 years of pharmacy education, students can become pharmacy aides, providing clerical and basic customer service. Progressing to the 3rd year, they can qualify as pharmacist assistants, supporting pharmacists in community and hospital practice settings. Ultimately, upon completing their internships, they can become pharmacy technicians, assisting in community, hospital, industrial, and research settings. Career-ready certifications, awarded by the Professional Regulation Commission Board of Pharmacy or the Technical Education and Skills Development Authority, equip students with essential skills to support pharmacists across various settings. This ensures they are workforce ready and capable of making meaningful contributions to the field. The proposed BS Pharmacy degree program in the framework offers diverse outcomes for its graduates, ensuring valuable career opportunities. Graduates who pass all 6 modules of the board exam earn a license as registered pharmacists, allowing them to fully practice as healthcare professionals. For those who do not pass all modules but successfully pass at least 3 modules, certification as pharmacy technicians is available. This enables them to support pharmacists in various settings, significantly contributing to the healthcare system while preparing for the next board exam. These pathways foster flexibility and inclusivity in professional advancement, ensuring that every graduate can pursue a fulfilling career in the field while also enhancing the marketability of the pharmacy degree programs. In the proposed framework, we are introducing optional advanced training aimed at increasing eligibility for foreign board exams while enhancing competency and qualifications in local practice. The BS in Pharmacy, major in Clinical Pharmacy, includes an optional fifth year, which extends the standard curriculum by one additional year and focuses on advanced clinical competencies and pharmacotherapeutics. Additionally, the PharmD program offers a sixth-year advanced clerkship that requires a BS Pharmacy degree and licensure. Students are encouraged to carefully evaluate their career goals and educational plans to make informed decisions that align with their aspirations and maximize their potential within the pharmacy profession. The major in clinical pharmacy is undertaken before graduation and the board exam, while the PharmD is pursued afterward. The PharmD program offers the advantage of a pathway leading to a Philippine Qualifications Framework Level 7 credential after passing the assessment of the specialty board. Schools may offer the optional 5th and 6th years if they meet specific criteria, including faculty members with PQF Level 7 to 8 credentials in clinical pharmacy, access to facilities capable of teaching system-based pharmacotherapeutics, and partnerships with hospitals that provide clinical pharmacy clerkships and residency programs. A Memorandum of Agreement, MOA, with these hospitals will facilitate advanced pharmacy practice experiences, ensuring students receive hands-on clinical training that enhances their professional development. In the proposed framework, the professional track introduces a structured and progressive pathway for pharmacists to achieve higher qualifications and specialize in their fields, complementing traditional academic routes like master's and PhD programs. The proposed additional pathway includes the Pharmacy Specialization Program Level 7, which equips graduates with advanced generalist or basic specialized pharmacy practice competencies, enhancing career opportunities in their chosen specialty. It also includes the Pharmacy Advanced Specialization Program Level 8, which develops advanced specialized competencies and leadership skills for high-level roles in the pharmacy profession. An important component of the framework is the establishment of a specialty board in pharmacy under the Professional Regulation Commission, PRC, which will qualify pharmacy specialty and pharmacy advanced specialty programs. This board will assess graduates of these programs through portfolios, specialty board examinations, and/or publications in related fields. The portfolio will compile work experience, continuing professional development, CPD, certifications, licenses earned, successful patient cases, and evaluations from peers and clients. To successfully implement the framework, we propose a ladderized outcome-based education curriculum that is carefully aligned with the Philippine Qualifications Framework, PQF. This curriculum offers a comprehensive and well-rounded education. Key features include a strong foundation in core pharmacy principles through courses such as general chemistry, pharmaceutical botany and taxonomy, human anatomy and physiology, perspectives of pharmacy, and introduction to health systems, ensuring a deep understanding of fundamental concepts. The curriculum emphasizes clinical pharmacy with courses like pharmacology, clinical pharmacy, and pharmacotherapeutics, providing the knowledge and practical skills needed for effective medication management and personalized patient care. In pharmaceutical science, courses like pharmaceutical chemistry and pharmaceutical analysis focus on drug development, formulation, and quality control, ensuring students understand the complexities of pharmaceutical products. Public health and primary care are addressed through courses in social and administrative pharmacy, public health, and epidemiology, preparing students to tackle public health issues and contribute to community health initiatives. Experiential learning through IPPE and EPP offers practical exposure to delivering pharmacy services in primary care settings, where students collaborate with other healthcare professionals to improve patient outcomes. By combining clinical expertise, pharmaceutical science, and public health knowledge, this curriculum ensures graduates are well-rounded pharmacists, capable of making significant contributions to the healthcare system and enhancing patient care. The curriculum offers targeted programs for subprofessional roles, including pharmacy aides, after 2 years, pharmacist assistants, after 3 years, and pharmacy technicians after 4 years, equipping students with essential skills and employment opportunities at every level. It ensures smooth transitions from sub-professional roles to a full professional pharmacy degree, allowing students to continue their education as circumstances permit. Introductory pharmacy practice experiences in community and hospital settings during the first and second years prepare students for various roles within the healthcare system. The first 2 years of the Bachelor of Science in Pharmacy program focus on building a strong foundation in the sciences, general education, and pharmacy fundamentals. Students take courses in chemistry, botany, calculations, and organic chemistry, as well as subjects like perspectives in pharmacy, legal aspects, and health systems. In addition to core pharmacy courses, students are required to complete general education subjects to develop their overall knowledge and skills. The curriculum includes both theoretical and practical components, with a mix of lectures, laboratory work, and clinical experiences. In the third and fourth years of the Bachelor of Science in Pharmacy program, students focus on developing advanced clinical skills and gaining practical experience. The third year includes core courses in clinical pharmacy, pharmacotherapeutics, and specialized areas such as drug discovery, development, and public health, along with 2 pharmacy thesis courses that allow students to apply their knowledge and conduct independent research. In the fourth year, students participate in experiential pharmacy practice internships, providing hands-on experience in various pharmacy settings, including regulatory, community, institutional, hospital, public health, primary care, academic, research, and industrial environments. This practical experience enables students to apply theoretical knowledge and develop essential skills for a successful pharmacy career. Importantly, the choice of internships, the number of units, and the required hours for each program are carefully aligned based on the availability of FDA-registered pharmacy establishments in the Philippines, making the curriculum evidence-based and reflective of the actual pharmaceutical landscape. The optional 5th year for the BS in Pharmacy, major in Clinical Pharmacy, and the 6th year for the PharmD program are designed to enhance students' clinical competencies and prepare them for international practice by meeting global educational eligibility requirements. The BS in Pharmacy, major in Clinical Pharmacy offers an optional pathway for advanced clinical training before the board exam, focusing on system-based pharmacotherapeutics, evidence-based medicine, and clinical assessment. In contrast, students must complete their BS Pharmacy degree and pass the board exam before enrolling in the PharmD program, which is exclusively available to licensed pharmacists in the Philippines. The PharmD clerkship is undertaken after completing the 5th year coursework, where students will engage in Advanced Pharmacy Practice Experience, APPE, in community settings, health institutions, ambulatory care, and other elective sites in hospitals. The PharmD program offers a pathway to attain a PQF Level 7 credential through a professional portfolio and a specialized board exam, providing significant advantages for career advancement both locally and internationally. An important outcome of the pharmacy roadmap activity is the clear delineation of roles and responsibilities, scope of practice, and the Philippine qualifications framework for both pharmacy professionals and sub-professionals. Pharmacy aides perform various clerical and support tasks across different settings. In community, institutional, and primary care pharmacies, they handle paperwork, administrative duties, inventory restocking, and workspace cleanliness, providing essential customer service and ensuring health product safety. In hospital pharmacies, aides manage phone calls, inventory, and act as medication pickers, alleviating the pharmacist's workload. In the industry, they assist in packaging, quality control, and inventory management, ensuring compliance with GXPs and regulatory standards, contributing to the smooth operation of the supply chain. Pharmacy assistants support pharmacists in community and hospital practice settings, playing a vital role in various support functions. They offer administrative and customer service assistance in community, institutional, and primary care pharmacies by delivering excellent customer service, managing medication inventory, filling prescriptions, and helping primary caregivers and end users make informed choices. They oversee back-end operations such as medication dispensing, compounding tasks, and inventory control, handle administrative tasks like insurance claims, prescription recording, and data entry, and coordinate day-to-day operations to ensure smooth workflows and regulatory compliance. In hospital pharmacies, they maintain medication storage areas, prepare prescriptions, handle patient inquiries, support pharmacists in timely medication delivery, assist with non-sterile medication preparation, medication reconciliation, and patient education, and ensure proper maintenance of pharmacy equipment and accurate medication compounding, aligning operations with clinical needs and hospital regulations. Pharmacy technicians support pharmacists in community, hospital, industrial, and academic settings. They assist with dispensing and compounding medications, managing inventory, processing prescriptions, and performing data entry. In hospitals, they prepare sterile and specialized medications, manage medication therapy, provide patient counseling, and maintain pharmacy equipment. In the pharmaceutical industry, they handle clerical tasks, manage lab inventories, assist with research, perform quality control tests, and ensure compliance with regulatory standards. In academic settings, certified technicians serve as lab assistants, managing equipment, supporting student training, and ensuring protocol compliance. Republic Act No. 10,918 defines the essential roles, responsibilities, and rights of Filipino registered pharmacists, ensuring their active participation in various facets of pharmacy practice. Registered pharmacists exclusively oversee and supervise pharmacy operations, assess and dispense medications, provide patient counseling and education, and monitor patient outcomes. They collaborate with healthcare professionals, conduct medication therapy management, and lead community health initiatives. They also supervise warehouse inventory, the pharmacy workforce, and perform key roles in the pharmaceutical industry such as signing regulatory documents, acting as qualified persons, and conducting quality control and pharmacovigilance. In academic settings, they serve as teaching assistants in pharmacy labs, providing crucial guidance to students. In addition to the roles and responsibilities outlined in Republic Act No. 10,918, holders of a SHED-recognized master's degree in pharmacy can engage in advanced practice and research, lead quality improvement projects, develop innovative services, conduct comprehensive research, and present findings at conferences. They also contribute to education by teaching, mentoring, organizing research forums, providing CPD training, and developing curricula. Publishing in reputable journals is encouraged to advance the field. In regulatory and manufacturing sectors, a master's degree can lead to managerial positions, offering greater responsibilities within organizations. In addition to the role of a registered pharmacist, becoming a board-certified pharmacist through a PharmD degree or residency program allows pharmacists to engage in advanced practice and various professional activities. Upon submitting a professional portfolio and passing the specialty board exam, pharmacists can lead quality improvement projects, develop new pharmacy services, and conduct research. They play vital roles in education and mentoring, organizing research forums, and providing CPD training. Board-certified pharmacists also serve as consultants for healthcare professionals, manage medication therapy, and contribute to primary health initiatives. In the industry, they oversee supply chain management, quality assurance, and ensure regulatory compliance. In addition to the roles of registered pharmacists, holders of a CHED-recognized PhD in pharmacy can engage in advanced practice and research. They design and lead original research projects, teach and mentor students, publish findings in reputable journals, present at conferences, and influence healthcare policy. PhD holders also serve as consultants on medication-related concerns, providing expert advice to healthcare providers and institutions. board-certified advanced specialized pharmacists lead innovative initiatives and set high standards of excellence in their fields. They teach and mentor students and professionals, oversee team growth, and shape pharmacy practice through policy development. As consultants, they provide expert advice and insights, guiding healthcare providers and institutions towards universal healthcare. Their involvement ensures that healthcare systems are efficient, effective, and patient-centered. The data presented provides a comprehensive snapshot of the Philippine pharmacy landscape. It highlights a growing number of pharmacy schools, currently at 144, but notes a decreasing trend in enrollment rates, a high dropout rate of 25 to 30%, and a moderate board exam passing rate at 60%. These raise concern about the production of pharmacists to meet the demand. In terms of degree-granting units, the number of institutions offering different pharmacy degrees include 144 offering bachelor's degrees, but only 10 master's, 5 PhD, and 5 PharmD programs. Additionally, a significant number of Filipino pharmacists working overseas may contribute to a domestic workforce shortages. The ratio of the pharmacists per 10,000 population is 5, which is on par with the global average but below the WHO recommendation. Out of the total 98,217 board exam passers, only 61,414 have valid licenses. What are the potential implications? First, workforce shortages. The increasing demand for pharmacists, coupled with the potential outflow of Filipino pharmacists to work abroad, could lead to a shortage of healthcare professionals. Second, quality of education. The high dropout rate suggests potential issues or challenges faced by students. Third, the licensure exam challenges. The moderate passing rate highlights the need to improve pharmacy education and examination preparation. To address these challenges, it is crucial to improve the quality of pharmacy education, increase support for students, and implement strategies to retain Filipino pharmacists. The data presented here shows several key trends in the Philippine pharmacy landscape from the demand side. According to the census, the population has grown a steady climb over the years with an average annual growth rate of 1.69%. This consistent increase in population underlines the growing demand for healthcare services. From 2021 to 2023, the supply-demand ratio gap shows a downward trend, indicating that the demand for pharmacists has outpaced the supply. Despite the increase in the number of pharmacists, this growth has not been sufficient to meet the escalating demand. If this trend continues, the growth in supply may be overtaken by the demand in the coming years. The majority of this demand comes from community pharmacy practice, reflecting findings from 2012, where community practice was the dominant sector. Both community and industrial pharmacy sector have a significant continuous increase over the years, while the other sector have shown slow to no growth. As of 2023, the regions with the highest demand for pharmacists are the National Capital Region, Region 3, and Region 4A. Conversely, the region in the lowest demand are BARMM, Region 13, and Region 4B. Furthermore, the FDA has registered significant number of health products in the Philippines, including 34,557 registered drug products, 13,223 cosmetic products, 8,280 food supplements, 1,926 veterinary products, and 905 medical devices. These overviews suggest that addressing the growing demand for pharmacists will require strategic efforts to enhance the supply, particularly focusing on regions and sectors with the highest need. In order to realize our vision, mission, and the proposed changes in the pharmacy education framework, a comprehensive plan has been formulated, focusing on 10 key action areas. These areas have been meticulously developed to address various aspects of the educational structure, ensuring a holistic approach to the advancement of pharmacy education. By implementing these targeted strategies, we aim to foster innovation, enhance the quality of education, and ultimately prepare future pharmacists to meet the evolving needs of the healthcare sector. This structured approach not only aligns with our overarching goals, but also sets a clear roadmap for the sustainable development and continuous improvement of pharmacy education. The first action plan focuses on curricular development and delivery. By 2030, the goal is to develop and implement a relevant outcomes-based curriculum tailored to meet the health and pharmaceutical care needs of different regions within the Philippines while aligning with international frameworks. Key performance indicators include the complete development of new curriculum frameworks and ensuring 100% of pharmacy schools implement the new curriculum framework. This effort will be led by the CHED Technical Panel for Pharmacy Education, in collaboration with other key stakeholders involved in education. The collective aim is to enhance the educational standards and ensure that pharmacy graduates are well equipped to meet both local and global healthcare challenges. Action Plan: 2 centers on faculty development and support. By 2030, the aim is for 60% of faculty members in each higher education institution, HEI, to be registered pharmacists who meet PQF Level 7 qualifications, including degrees in public health, chemistry, microbiology, and MBA. These faculty members will be competent in delivering high-quality education, supported by a relevant faculty development program. The Philippines Association of Colleges of Pharmacy, PACOP, can take the lead, supported by the CHED Technical Panel for Pharmacy Education and other key agencies. Crucially, professional pharmacy courses will be strictly handled by registered pharmacists with PQF Level 7 or higher qualifications, as mandated by law. While there is flexibility in the type of master's degrees or pathways to Level 7, all faculty must be registered pharmacists. This initiative ensures educational standards are met and pharmacists are well prepared for both local and global challenges. Action Plan 3 focuses on enhancing collaboration, partnerships, and networking. By 2030, it aims to strengthen the networking among pharmacy schools and the pharmaceutical industry, both locally and globally, to promote lifelong learning, innovation, and the integration of practicing pharmacists into the academic environment through the establishment of Memorandum of Understanding and Memorandum of Agreement of entities involved. Each school will strive to have at least one active partnership annually in areas such as community, hospital, industry, public health, primary care, and regulatory practices for collaborative projects with professional stakeholders. The Philippine Pharmacists Association, along with its chapters and affiliate organizations, will facilitate these collaborations, supported by pharmacy schools, government agencies, private institutions, and professional stakeholders. To address the growing gap between the demand for pharmacists in the healthcare system, both locally and abroad, and the supply of pharmacists, Action Plan 4 focuses on recruitment and enrollment. By 2030, the goal is to increase enrollment in pharmacy programs by at least 10%, especially in state universities, to meet this rising demand. The Commission on Higher Education CHED will lead the efforts in collaboration with the Department of Education, while the main responsibility will fall on pharmacy schools, state universities, the Philippine Association of Colleges of Pharmacy, the Philippine Pharmacists Association, the Mindanao Alliance of Pharmacy Schools, and the Federation of Junior Chapters of the Philippine Pharmacists Association. These key organizations will create implementation plan and interventions to attract more students to pursue pharmacy education. At present, only 6 schools of pharmacy offer subsidized education, and few schools can avail of the Department of Science and Technology (DOST) scholarships. Action Plan 5 aims to expand scholarship opportunities. By 2030, at least 8 state universities and colleges will offer accredited pharmacy programs with enhanced access to scholarships for both students and faculty. Collaborations with local government units, the Commission on Higher Education, DOST, industry partners, and international organizations will support educational and research opportunities, advancing qualifications and expertise across the profession. The plan aims to increase the number of scholarship opportunities by 50% for both students and faculty by 2030. Partnerships will be established with at least 5 industry and international organizations to fund scholarships and support educational initiatives by 2027. The number of scholarship recipients will increase by 30% annually, reaching a total of 500 by 2027-2030. The Philippine Pharmacists Association will take the lead in engaging scholarship providers to prioritize pharmacy, including CHED, state universities, the University of the Philippines, DOST, local government units, international organizations, industry partners, among others. Over the past 2 decades, the national passing rate for the pharmacist licensure examination has averaged around 60%. Given the increasing need for pharmacists, the significant percentage of candidates who fail each board exam represents an untapped potential. Action Plan 6 aims to enhance performance in these exams. By 2030, the goal is to achieve a national passing rate of at least 70% on the pharmacist licensure examination. This plan involves a sustained improvement across all pharmacy schools, raising the national passing rate from 60% to 70%. The Professional Regulations Commission Board of Pharmacy will take the lead, while the Commission on Higher Education will implement a monitoring system. The Philippine Association of Colleges of Pharmacy and Industry Partners will support schools and students requiring additional assistance, ensuring a collective effort to improve exam performance. The proposed changes in the pharmacy education framework require the thorough implementation of Action Plan 7, focusing on regulatory, accreditation, and infrastructure improvements. By 2030, the Technical Education and Skills Development Authority will certify subprofessional programs from National Certificate 2 to Diploma Level 5, while the Professional Regulation Commission will establish specialty boards for priority pharmacy areas such as clinical pharmaceutical sciences and social and administrative pharmacy. Pharmacy-related policies will be updated by 2026 with stakeholder approval to support these regulatory and accreditation efforts. By 2027, integrated certification will be achieved for 3 sub-professional pharmacy programs. By 2030, specialty boards will be established for at least 3 priority pharmacy areas. The Commission on Higher Education, PRC Board of Pharmacy, Technical Education and Skills Development Authority, partner institutions for certification like the Federation of Asian Pharmaceutical Associations, College of Pharmacy, and specialty boards for medicine will play key roles in this initiative, ensuring enhanced workforce qualifications and professional standards across the profession. Action Plan 8 focuses on career pathways and professional growth. By 2030, the aim is to collectively increase the number of specialization centers in colleges and universities of pharmacy in the Philippines in both academic and professional tracks. These centers will serve as hubs where students, faculty members, and professionals from various schools can receive training and development. The goal is to achieve a 10% increase in pharmacy graduates and professionals with specializations. This initiative will involve the Professional Regulation Board of Pharmacy, the Commission on Higher Education, CHED, the Philippine Association of Colleges of Pharmacy, identified partner institutions, specialized pharmacist societies and organizations, and pharmacy schools, all working together to support and advance the professional growth of pharmacists. To significantly contribute to the implementation of universal health care in the Philippines and re-establish our role as pharmacy experts in the community, Action Plan 9 focuses on leadership in primary care. By 2030, the goal is for all municipalities and cities to have at least one FDA-licensed pharmacy in government primary care facilities, which is crucial for achieving UHC. Additionally, by 2030, at least 50% of first to third class municipalities should have at least one full-time registered Filipino pharmacist dedicated to effectively implementing UHC. The objective is to achieve 100% coverage of all municipalities and cities with at least one FDA-licensed pharmacy in government primary care facilities. Key organizations involved in this initiative include the Department of Health, Health Facilities and Services Regulatory Bureau, the Food and Drug Administration, PhilHealth, the Department of the Interior and Local Government, PhilHealth, the Association of Municipal Health Officers of the Philippines, AMHOP, and the League of Municipalities of the Philippines, among others. The last action plan, Action Plan 10, focuses on the global recognition of Filipino pharmacists. By 2030, the goal is for Filipino pharmacists to be globally recognized for their merit, competence, and qualifications. This includes increasing the number of Filipino pharmacists receiving international recognition and ensuring more countries have reciprocity agreements for Filipino pharmacists. Efforts will also be made to boost the number of research publications in reputable international journals and to increase the number of Filipino pharmacists invited as resource speakers and holding key positions in international conferences. Additionally, there will be an emphasis on having more manuals and publications by Filipino pharmacists adopted by other researchers, and increasing the use of locally produced technologies, such as products and patents by international industries. Key organizations involved in this initiative include the Philippine Pharmacists Association, the Commission on Higher Education, local and international pharmacy associations, and pharmacy schools. In conclusion, the roadmap team believes that these 10 action plans will significantly improve the pharmacy landscape if implemented correctly. The written manual for the roadmap provides a detailed action plan, yearly milestones, and recommended strategies. It also includes situational analysis, SWOT analysis, benchmarking analysis, policy analysis, supply-demand analysis, and global alignment analysis to further understand the rationale and proposed implementation plan. We strongly recommend that pharmacy leaders mobilize key leaders and teams for each action plan, with an open volunteer system for those interested in joining the 5-year implementation team, supported by adequate funding. If all action plans achieve their individual goals and timelines, we are confident that our vision and mission will be closer to reality. As we look ahead to 2030, we are committed to achieving significant milestones that will shape our future. Recognizing the progress we've achieved thus far, our focus will be on building upon these successes. In the coming years, our unwavering dedication will be directed towards advancing pharmacy education and the profession, leading to improved health outcomes for all. This progress will be guided by a strategic plan and a shared roadmap that unites our collective efforts, emphasizing the importance of adhering to timelines to ensure that we stay on track and reach our goals effectively. This timeline outlines our strategic plan for the next 2 years, focusing on 2 key phases. In 2025, we will lay the foundation by establishing a robust organizational framework, forming dedicated task forces for each action plan, and developing comprehensive strategic plans to ensure our initiatives are well coordinated and aligned with our vision. In 2026, we will launch new academic initiatives and enhance faculty qualifications, strengthening industry partnerships to improve pharmacy education, and better prepare students for the workforce. A key milestone will be the creation and launch of the ladderized outcome-based curriculum through a CMO, ensuring our curriculum meets the evolving needs of the healthcare industry. In Phase 3, strengthening partnerships, policy, and infrastructure in 2027, our primary goal is to enhance collaborative networks, refine policies, and improve infrastructure to support sustainable growth in pharmacy education and practice. We will establish robust partnerships and improve regulatory standards and infrastructure to ensure the effective delivery of pharmacy education. In Phase 4, elevating professional growth and leadership in 2028, our focus shifts to enhancing the professional growth and leadership capacity of pharmacy practitioners and educators to meet evolving healthcare needs. We aim to implement initiatives that empower pharmacy professionals through education, training, and collaborative partnerships. By focusing on these key areas, we will continue to advance the field of pharmacy and ensure that our students and graduates are well prepared to meet the challenges and opportunities of the future.
Phases 5 and 6 of our strategic plan focus on advancing pharmacy practice and education by 2029 and achieving global recognition and sustainability by 2030. We'll implement innovative educational strategies, enhance faculty qualifications, and establish robust partnership to ensure that our graduates are prepared for global health needs. These efforts will solidify the Philippines as a leader in pharmacy education and practice, fostering continuous professional development and innovation in the field.
The core team would like to acknowledge the invaluable contributions of our colleagues who played a crucial role in the development and delivery of the Pharmacy Education Roadmap 2030. This roadmap builds upon the dedicated efforts of our technical panel, consultants, and the more than 400 Filipino pharmacists and stakeholders from various sectors and government agencies who participated in our focused group discussions, public consultations, and technical workshops, both in person and online across the Philippines. This work is dedicated to the future generation of pharmacists. Through our collective effort, we will elevate our profession to unprecedented heights and transform healthcare for all.